Nursing students, if you're fixing to take your NCLEX very soon and this doesn't click yet, let's fix that today. So let's talk about DKA or diabetic ketoacidosis. So let's see what NCLEX is really trying to look for in this DKA diabetic ketoacidosis. So this is what you need to look for, and these are the signs and symptoms that you will see in patients that have DKA. Now, more than likely, the patient is a type 1 diabetic, okay? That's typically the patients that are going to end up with DKA. Now, what are the clinical signs? So let's look at that together. The first thing that you're gonna see would be hyperglycemia because it's DKA, right? So your blood sugar is around the 400 milligrams per deciliter mark. So around 400 to 500. If the blood sugar is going around greater than 600, I'm just gonna put it here, and that would be your hyperosmolar hyperglycemic syndrome, which is another type of hyperglycemic episodes, but this is typically for type 2 diabetes, right? Okay, so aside from the hyperglycemia, which is going to be around 400s, the other symptoms that you're gonna see is ketones, okay? And these ketones can be in the bloodule or it can be in the urine. So the wording K in DKA is the one that suggests that there is going to be ketone. The other significant thing about DKA is the ABG imbalance, and you guessed it right, it's going to be metabolic acidosis. Not metabolic alkalosis, not respiratory acidosis, but it's going to be metabolic acidosis. The other thing that NCLEX is looking for is the type of breath, and we call that fruity breath. That's what we always say. The other thing is the patient is going to have Kussmaul's breathing or respiration. This is the rapid respiration that you're gonna see in patients who have DKA. Now, the fact that the patients are peeing a lot, because remember, one of the signs and symptoms of hyperglycemia is polyuria, right? So the fact that the patient is peeing a lot, guess what you're gonna see? So let me put it on the other side. You're gonna see dehydration, right? You're gonna see dry mucous membrane, right? Membrane. You're gonna see poor skin turgor. Those are clinical manifestations that you're gonna have. Now, if the condition is so severe, if it's so severe, you're gonna see patients with altered mental status. So what do you think? What is the possibility that NCLEX is going to ask you for the signs and symptoms? These are potentially the question they're gonna ask or they're gonna put in the stem. Hyperglycemia is number 1, ketones, metabolic acidosis, and Kussmaul's breathing. Those are potentially the clinical manifestations that you're gonna be seeing with DKA in your NCLEX exam. Now, let's look at the nursing priority, okay? So NCLEX like to ask for prioritization questions. So in this particular instance, the priority is going to be hydration. because these are the treatment modalities. So hydration first in the form of an isotonic solution. Okay, an example of that isotonic solution would be normal saline. Okay, the next step is the administration of insulin. So remember, insulin is the second step, not the first priority. And the reason why you want to give fluids first, because insulin is not going to be circulating in the body if you don't have fluids. Remember, your insulin is given here as in an IV form. And guess what kind of insulin that we only give IV? It's what we call regular insulin. Right? Okay. So the next priority here is to administer, depending on the labs, fluids that have potassium, either supplements. More than likely it's going to be supplements. So why do you think we feel that that would be the choice? Well, remember, the patient is peeing a lot. So guess what happens to the potassium level if the patient is, remember, polyuria is a clinical manifestation of hyperglycemia. So it's either supplementation of potassium, and usually it's given in the IV bag, because remember, we only give potassium via IV infusion, right? So that's the next step. And then the last step is, if the blood sugar, remember it started at around 400, right, over here, right, remember that? Now, if the blood sugar is going to normalize, because we already gave fluid and we already gave insulin, guess what? If the blood sugar is around 200 to 250, that's the time we add D5-half-NS as our IV fluid. And the reason why we add a D5 in the equation, because we don't want that patient to go hypoglycemic. Because remember, we have insulin already administered after fluid hydration. So hopefully this DKA is gonna stick, and try to watch this video over and over again, because the idea of this video is going to help you with any DKA questions in your NCLEX exam. Save this video for later, and if you could repost this video, like and follow, that would be great. Thank you.